Hello, everyone. My name is Ahmed. I'm a third-year pathology resident, and today I'm going to be talking about acute myeloid leukemia with RBM15 MRTFA fusion. This is a super rare acute myeloid leukemia that accounts for less than 1% of all acute myeloid leukemia cases, and it accounts for about 10 to 12% of pediatric acute megakaryoblast leukemia cases. It has higher incidence in infants and children less than or equal to 3 years without Down syndrome. Most patients present with marked hepatosplenomegaly, anemia, thrombocytopenia, and slightly elevated white blood cell count. However, infants often present with extramedullary disease and fibrotic abdominal organs, sometimes affecting the liver, and this may result in presentation with Budd-Chiari syndrome. Morphologically, the blasts have megakaryocytic differentiation. So you can see megakaryoblasts that are usually medium-sized to large with a round, irregular, or convoluted nucleus containing several nucleoli and fine reticular chromatin. The cytoplasm of these megakaryoplasts is often agranular and basophilic, and it may have blebs. Also, it's important to know that megakaryoplasts may be mixed with more morphologically undifferentiated blasts with a high NC ratio resembling lymphoblasts, and these patients may have normal or hypercellular marrow with fibrosis. Immunophenotypically, these blasts may show expression of one or more of the platelet glycoproteins CD41, CD61, as well as CD42B. Blasts can be positive for CD13 and CD33. However, CD45, CD34, HLA-DR, MPO, TDT, and lymphoid markers are usually negative. The molecular findings in this entity include translocation 122, resulting in RBM15 MRTFA fusion, and in most cases, this is often the only karyotypic abnormality seen. To make this diagnosis, you need to see a myeloid neoplasm with increased blasts in the peripheral blood or the bone marrow. They may be less than 20%, and it's not common to see these blasts in the peripheral blood in this leukemia. You also need to identify the RBM15 MRTFA fusion. A desirable criteria would be detection of the translocation 122 by karyotype analysis and demonstration of megakaryocytic differentiation. As for the prognosis for this entity, it's not actually uniform. Some studies showed intermediate prognosis. However, other studies showed good prognosis. So we don't have enough data right now to decide whether the prognosis for this entity is good, intermediate, or bad. So if there's one thing that I want you to remember about this leukemia is that blasts can show megakaryocytic differentiation. This is the end of this video, and see you next time.